Thank you very much, and I appreciate your sympathy in advance. I am a bit of a footy tragic, I guess you have to be if you follow Port Adelaide. But I do have one last hope. My father used to play for a team called South Melbourne, which many of you will know is now the Sydney Swans. So I've got a glimmer left. I've got a glimmer. So we're all hoping. Look, thanks for that introduction, and what a pleasure it is to be here today. I hate being the last speaker, and luckily there's a panel after me, because that usually means if you're the last speaker, you're standing between the audience and drinks. And so in the interest of that, I shall be brief. I'd like to thank the Institute for the invitation and congratulate the Institute as well for its dedication to achieving safe and healthy Australian workplaces. Today, what I want to do is give you a brief overview of the Comcare scheme, of its structure and what I consider to be its comprehensive capability, some current trends in our performance and the challenges that we face. I'll also take the opportunity to dispel some myths and misconceptions about Comcare and give you an insight into what's planned for the scheme into the future. And I'll share with you some of the work Comcare is doing to create a better understanding and acceptance of the positive relationship between work and health. The understanding of that relationship and the fostering of better knowledge about the relationship between work and health, and helping the community evolve in its understanding of the importance of work to health and well-being and the powerful benefits that come from that, not only for individuals but for communities, for families, for colleagues and workplaces, is what I'm making a goal of my 5-year term as Comcare's Chief Exec. I've served 1 year of that term, so I really want to focus on that return to work, recover at work, prevention and the health benefits of work, and I'll talk a little bit about that later. Okay, Comcare's place in the regulatory landscape is unique. We're established under the Safety, Rehabilitation and Compensation Act, and with, as you've heard Barry say, the Safety, Rehabilitation and Compensation Commission, we administer the Commonwealth's statutory framework for rehabilitation and workers' compensation. We are also the National Work Health and Safety Regulator under the Federal Work Health and Safety Act. The Comcare scheme provides employers, including the scheme's licensed corporations, with an integrated Safety, Rehabilitation and Compensation Commission, no matter which state or territory an employer operates in or where its employees are located. An overarching role is to work in partnership with employers, employees and others to prevent workplace injury and disease. A common misconception, and one I want to dispel today, is that Comcare is primarily a white-collar public service regulator. As some have described, the worst thing that happens in the Commonwealth scheme is a paper cut. The reality is extremely different, even amongst our public sector agencies. And as you can see from some of the companies listed up there, we cover a very broad range of industries and occupations. The scheme's risk and occupation types have always been diverse, extending well beyond some of the lower risk white-collar occupations, as I've said. They include defence, law enforcement and border protection operations, both in Australia and overseas. Scientific, medical and research operations, including nuclear science. Maritime and aviation operations, again, both within Australia and overseas. Technical and manual occupations, often in remote and challenging locations, telecommunications, road and rail transport and logistics, manufacturing and construction, and banking and financial services. The Comcare Workers' Compensation Scheme through the SRC Act covers around 376,000 employees from the federal government and the ACT government, and about 161,000 employees from 33 licensed self-insurers. Under the Work Health and Safety Act, Comcare regulates more than 400,000 employees, including nearly 200,000 from the Australian Government, 157,000 from licensed self-insurers, and 62,000 from the Australian Defence Force. We regulate around 25% of all Australian workers in the fields of public administration and safety, and in telecommunications and information media. We regulate almost 15% of workers in financial and insurance services, and nearly 9% of all Australian workers in transport, postal and warehousing. Employees in these industries are, of course, as I said, spread around Australia and some overseas locations, and across a broad range of occupations. Comcare takes a risk-based approach to regulation to enable us to respond accordingly to large and complex Commonwealth organisations and also a diverse range of industry employers such as John Holland Construction, Trans-Pacific Industries and Waste Management, Telstra and Australia Post, to name a few. This can mean allocating resources where we identify they're needed most, where the compliance risk is greatest, for example, and in doing so, we also aim to reduce the regulatory burden on employers by considering the risk profile of each of the varied organisations in the Comcare scheme. Comcare is uniquely placed to provide a national response. Because of the nature of the scheme, we can identify emerging issues on a national basis swiftly and respond effectively. A good example of this was the issue of asbestos in telecommunications pits identified during the rollout of the NBN. Comcare was able to respond with a nationwide remediation program that achieved significant preventative safety outcomes, especially with regard to improved contractor supervision. And in addition, Telstra and NBN have set standards for remediation work and training above the minimum standards required by the law, raising work health and safety prevention levels within the industry. At the other end of the scale, of course, we will always take decisive action where necessary. For example, Comcare took action against a national waste management company over a fatal truck crash in Perth. It was a complex investigation, and we worked jointly with the state regulator as well. But that prosecution saw a record penalty handed down by the Federal Court earlier this year. Our regulatory approach is one that is modern and multifaceted, balancing enforcement with education and strong partnerships. We educate and promote through campaigns and programs to enable safer and healthier workplaces. Everything from road transport safety to reducing the incidence of musculoskeletal disorders. And we partner with employers to identify and rectify unsafe work environments and practices. Of course, and you'll hear from Claire Ames tomorrow, no one model of regulation will necessarily suit a regulator's needs. It's a matter of achieving a right mix to get the best outcomes. In the Comcare jurisdiction, our work health and safety statistics for injury and death rates show the effectiveness, I think, of the regulatory work. Comcare data for 2012-13, which is the latest data available, shows a rate of 6.2 serious claims per 1,000 FTE for the Comcare jurisdiction, compared with the Australian average of 11.1. We're the lowest of any jurisdiction. Barry mentioned the Regulator Performance Framework, and the federal government introduced this earlier, and we've introduced this since July this year. It's a framework that sets out the approach for every Commonwealth government agency who is a regulator. It's designed to minimise regulatory burden, increase consultation across the various jurisdictions, and provide a set of KPIs to be developed that give transparency to our roles, transparency to our operations, and transparency to the way in which we'll regulate, and so people are very clear. As I say, it was introduced and came into effect from 1 July this year. It goes hand in hand with the government's target to reduce red tape, the red tape burden, by $1 billion a year. And we're using that as an opportunity to refresh and look at what we do and make sure that we engage very heavily with our stakeholders, both the employees, employers, and their representatives. Can I just mention very briefly our return to work rates, because that's also a measure of the work that our employers and employees do and the way in which we regulate. The scheme has consistently had one of the highest return to work rates of all jurisdictions across Australia and New Zealand. Our return to work rate is 80%, the equal highest in the most recent comparative data. As well, injury and disease claim numbers for the scheme continues to fall by around 15% across the scheme since 2009-10. However, we face the ongoing challenge, as a number of jurisdictions do, with the impact of psychological injury claims. Across government agencies, you'll see from this slide that psychological injury claims, while all claims have been going down, are making up 15% of all claims, but they represent 48% nearly 40% of cost and 48% of all time lost. And while we're working hard on many initiatives for the prevention of psychological injury, for the management of mental illness in the workplace, there's a lot more that we can do. There are significant opportunities to get people back to good work and good health sooner by focusing on the tangible links between work and health. And I mentioned at the very start of this that this is one of our priority areas that I'm very, very keen to make sure we have a coordinated approach across all jurisdictions. And we've been doing some work in the ACT that is focused on a GP Fit certificate. I know both here in Victoria and in New South Wales, you've rolled out Fit certificates in certain parts of the jurisdiction. And so we trialled in the ACT this, and we're rolling it out as we speak, really, in terms of working with GPs, so that the focus is about recovery at work, return to work. It's really, if you look at all of the statistics, you know that after spending 20 days off work, an employee has a 70% chance of ever returning to work. Fast forward that to the 70-day mark, and the likelihood of returning to work drops to just 35%. That is an enormous loss in workforce participation and productivity to the Australian economy. Our Health Benefits of Work program is based on the evidence that participation in work can drive health and productivity improvements, and aims to improve return to work and work retention of people with injury and disability. I said a key focus of that is working with GPs, rehabilitation providers and employers, so that we can all provide the flexibility to allow us to have people in the workplace who aren't fully fit. And I think that can be best summed up that you don't have to be 100% well to be at work. In fact, more people are likely to recover from ill health and injury when at work. Barry, I think, has covered the legislative amendments, so I won't go into those. But I will just say that we are, with our Health Benefits of Work program, we've appointed a Work for Health advisor, some of whom I'm sure you will know this person, Professor Nikki Ellis. She is well renowned in this field. She's helping us with our work to promote the public and policy position on the positive links between work and health. She's an occupational and public health physician with significant experience and expertise in research, evaluation and policy development in this area. Nikki is going around and talking to a whole raft of organisations and individuals, and if you have the opportunity to have a conversation with Nikki, I would suggest that you take that opportunity. Okay, so what's next? In conclusion, we've just published our new corporate plan, and if any of you want to go onto our website to look at it, I encourage you to do so. It sets some ambitious targets and goals for us. We want to make sure that we are a leading insurer, a national regulator who operates in a regulatory model that is appropriate but delivers results. We want to be excellent in scheme management design, and we want to be the most cost effective we can in doing all of that. So our goals include reductions in premium and liability, higher return to work rates with a real focus on return to work and recovery at work. Within Comcare, that's a new direction for us, and we want to work with all of our partners in achieving that. So without any further ado, and I'll shorten the time so drinks are closer, thank you very much indeed.